Hello and welcome to today's webinar, Leveraging AI with Coding and Billing. My name is Samantha Burke and I'm NERUCA's Administrative Director. Now, before we get started, I'd like to go over a few housekeeping items. So today's webinar is being recorded and questions will be addressed at the end of the presentation, but we invite you to submit your questions using that Q&A chat box at the bottom of the screen. Now, for those of you who don't know, NERUCA, we're in our 12th year of existence. And today, NERUCA provides grassroots local representation in partnership with UCA's National Strength, tackles legislative issues at the state level, integrates urgent care medicine into broader public health initiatives, and provides education and advocacy for urgent care medicine in the Northeast. Now, we do all of this through programming, including today's webinar and our annual conference, which is our signature event of the year. Our next conference will be at Foxwoods Resort and Casino in Connecticut from September 28th to the 30th. Now, lastly, I'd like to thank our Platinum sponsors for their continuing support: Medline, Aptitude Medical, BD, Solve, HealthTrack RX, Stat Biomedical, and last but not least, today's sponsor, Extion. Now, those interested in either sponsoring, exhibiting, or speaking should be receiving communications shortly. Please feel free to always email us at admin@neruca.org with any questions and comments that you may have. And with that, it is my distinct pleasure to introduce you to Mark McKinsey.
Hey, good morning. Thank you so much. Mark McKinsey here with Extion Health, and excited to present Leveraging AI with Coding and Billing. And I've got with me Nikki Rebeloso. Go ahead, Nikki, introduce yourself.
Hi, everybody. Thank you for joining us today. Good afternoon to our East Coast attendees, and still good morning to the rest of us. I have had the pleasure of working with Extion for the last year, being able to identify areas where AI could help other urgent care centers become more efficient, accurate, and which helps with patient care in the end. So I'm really excited to be a part of this presentation, help you guys identify what AI is, how it can help with coding and billing, and what that would look like to implement.
Nikki, will you go to the next slide?
Mm-hmm.
Yeah. Yeah. Well, yeah, it's being recorded, so they can read that later. Just the next one is the key takeaways. So the hope here today is really kind of impart some wisdom regarding the impact of AI in urgent care as it relates to coding and billing and how to leverage, exploring those benefits of AI-driven revenue cycle management and what that looks like, and then learning how AI improves clinical documentation and the successful artificial intelligence integration. And then we'll field some questions and just post those in the Q&A chat, if you would. Not the chat, but the Q&A provided box, and we'll address those at the end. And without further ado, I'll roll it over to Nikki.
All right. Thanks, Mark. Appreciate it. All right. Well, let's dive in and get started. So the impact of AI, as most of you guys have probably heard, it's here, it's now, and it is transforming urgent care centers by introducing new tools to help providers, operators, revenue cycle teams to improve treatment, enhance accuracy, efficiency, and also give some personalized patient engagement. So the AI tools that there are out there right now really can go from beginning to end. So once that patient walks in, they can utilize AI for registration, triage can be done with it, eligibility and benefits, your whole revenue cycle process, all the way through payment posting and denial management. So it's been amazing to see the development of all of these tools and how they're assisting. And some statistics that we were able to pull here. So roughly about 85%, this number has grown, of healthcare leaders are evaluating AI for revenue cycle processing tasks. So it is becoming more prominent in the space, and more people are wanting to learn about it. And about 92% of healthcare operations are now becoming automated, and that is specifically through AI, which you can see it increases productivity, which we found about 74%, and that is actually growing. Productivity is being enhanced, so you're able to get through more tasks a lot quicker. Sorry. All right. So how does AI impact coding and billing, which is what we're specifically talking about today? So as I was stating, it increases accuracy. The big piece for me being compliance is it reduces errors, which in turn, I mean, this is a cycle. It's faster processing, it's cost reduction. That could be for your operations reduction there. It improves your cash flow, so the velocity of your reimbursements. And a really cool piece of it, it also enhances your data analytics. So you're able to identify some trends. You're able to see, what payers are paying for this, they're not paying for that. What are they commonly denying or rejecting? And so, again, some statistics here to show you guys. We've identified that there's about a 95% improved billing accuracy. And with that, we were able to minimize around 35% errors. And big one is reducing claim denials by 20%. So as you can see, it is a cyclical event that happens, and starting from the time that patient walks in the door all the way through your revenue cycle, the impact of AI is prominent. All right, so revenue cycle management, we all know RCM. It is, and it continues to be, one of the pain points and largest challenges for a lot of urgent care providers. Being able to manage complex patient data, to combat insurance denials, rejections. The challenges can be negatively impacting to providers and their ability to deliver patient care. As you can see on the bottom part here, coding errors, they result in documentation misinterpretation. Some of that could be due to lack of training, which then goes into incomplete information, issues with verification of insurance, and then, of course, human error. So the plus with AI implementation is being able to get ahead of all of these different aspects. We are human. I've been doing coding for over 18 years. I've been in revenue cycle for that time. And I have seen, from being on paper charts and circling, codes on super bills all the way through, utilizing EHR. And now we're to this point where we're all looking at what can AI do for us? How can we utilize it to help reduce all of these different aspects? So RCM issues, obviously that affects our ROI, which is something that we cannot afford. So rejected claims, denials, registration errors, you guys know that is huge. I find registration and benefits rejections and denials tend to be the highest percent that come in over coding errors. So being able to get ahead of that with some AI tools to do automated benefit analysis or checks and reduce, having to be on the phone forever on hold, especially with, we know Blue Cross is a big one there. And so being able to combat that at the beginning, obviously reducing that administrative burden. And so we all know RCM issues, they do not discriminate. So with claim submissions, we're able to combat those delays and inaccuracies and resubmissions. Every time we resubmit a claim, that ages the claim, and it also we have to utilize our staff for those additional resubmissions. That costs money. Compliance, outdated practices. Are we keeping up with the ICD changes? Are we keeping up with CMS changes? Are we keeping up with the new CPT codes that roll out? And with compliance, a big one is we want to avoid any risk of audits, fines, recoupments. Recently, I'm sure some of you may have seen that Medicare Advantage is ramping up their audits. So they are going to be hitting some places with potential recoupments. And hopefully you guys don't get fines, but this is where AI comes in and you can prevent those things from happening. The other big piece is, we want people to come back. So your practice reputation, reducing patient complaints because they're able to get better care. Those poor reviews that come from patients. And then the biggie is staff turnover. We all know that provider burnout, changes in processes can, potentially cause some disgruntled staff, and they may not want to stay up with the changes. So all of these areas we have to recognize are going to impact our ROI at the end of the day. And how AI can come into play with this is where we can save some money. We can increase that ROI through reimbursements on claims and also your operations costs. All right, so let's look at benefits of AI-driven revenue cycle management. So how is AI revolutionizing billing and coding? A big one is minimizing administrative burden. So instead of utilizing, an FTE to do so many claims a day, AI can actually automate all those repetitive tasks. So we're able to put AI in place to process thousands of claims a day. And so you don't have to have your revenue cycle team working, say, 20 claims a day for if you have, high volume visits or plus 100 claims a day, however your setup is. So you can automate all of those repetitive tasks. The denials and rejections. What's really neat is that AI can actually identify the correct billing and coding errors prior to submission. So you're able to identify, okay, provider A did not capture the site for an injection, or, to make it compliant, or the provider did an X-ray, but they missed documenting it. So AI is able to identify a lot of those to prevent denials and rejections from happening on the back end. And then also big one is maintaining compliance. So are there inconsistencies in the documentation in the medical records? When we identify those, we're able to go back to the providers and talk to them about it on a one-on-one instead of, saying a blanket statement to all providers, which falls on deaf ears. Some of them may not even attend the training. So we want to be able to say, provider Johnson, he missed, XYZ in his documentation. Let's do some one-on-one training with him so he can better understand what he needs to document and how. So all of this obviously, creates less errors. It increases your reimbursement timeframe. and helps increase your ROI. So clinical documentation improvement, how does AI improve that? So obviously by improving your accuracy and quality, it enhances your proficiency and productivity, and then also reduce costs, increases your revenue, and then in the end, you have better patient care. So there are AI tools that do real-time clinical decision support, which is a really neat enhancement for providers. So AI will use algorithms to analyze that patient data during the documentation process and provide real-time suggestions to clinicians, making sure that all the relevant clinical information is captured. It can also automate the review of clinical documentation, identifying those inconsistencies, gaps, or potential errors that might be missed during manual reviews. And then it can also prompt missing diagnosis, procedures, and other critical details that may impact the coding and billing. All of that really assists the provider. So essentially, it's an assistant to the provider while they're documenting in their chart to be able to capture all the things that are necessary, identifying those specific diagnosis rather than those unspecified. We know that insurance payers will like to deny or kick back some of those unspecified diagnoses. So with the AI algorithms, you can actually filter through all of that information to identify those.
Yeah, Nikki, let me add one thing.
Yeah.
So in this clinical documentation improvement, really the goal is more tactical education for the provider. So if, for instance, coding with provider A, they're very good at coding respiratory, I beg your pardon, documenting it respiratory, but they need help in ortho, for instance. And then provider B is the opposite, really good at ortho, but needs help in respiratory. So following that documentation, now you've got some tactical education opportunity, individual for the provider for those specific areas. So now you should see that documentation improve, and then by proxy, you're going to see the better coding capability for the AI tool as it's learning. So it's kind of a dual prong approach. The AI is always constantly learning, and now the provider is getting some tactical education on documentation.
Thank you, Mark. That's a great point there. All right, so to continue with AI enhancing CDI, so you can improve it significantly by streamlining processes, enhancing accuracy, of course, detecting those errors, and identifying documentation discrepancies. So another AI enhancement is that there are predictive analytics that you can use for documentation improvement. So the AI system can actually analyze historical documentation data to identify patterns and predict areas where documentation improvement efforts should be focused. And this is a proactive approach, allowing healthcare organizations to address potential issues before they lead to claim denials or compliance problems. And if the AI identifies any of these inaccuracies or possibly missing elements to the chart, then you have a streamlined generation of queries, targeted queries to the providers that, based on their documentation gaps or coding concerns, will allow that communication process with the provider so they can then go in and update their charts. And then also they would be able to see with those queries, any inconsistencies that they are making over and over and over again, and essentially learning from those so that they don't continue to occur.
Yeah, I mean, the goal is to get this information correct prior to going to the clearinghouse, because we don't want a denial or rejection, whatever the case may be. So our goal, or with AI on the coding and billing side, is to correct all of those prior to going to the clearinghouse for reimbursement from the payer. So that's really the goal.
Yeah. And the other important piece too is AI can also assist with that compliance monitoring piece in the CDI by ensuring documentation meets regulatory and payer requirements. So, if United Healthcare or Medicare, for instance, changes up some policy, then the AI is able to stay on top of that and make sure that those pieces are being coded correctly, billed correctly, versus a human having to go in and do the research, and this is done in a much quicker fashion.
Yeah, Nikki, let me add another point too. A couple of slides ago, you mentioned recoupments or clawbacks or whatever the case may be. So with this data that AI is performing, now you've got more of a defensible position if that does happen based on this data. So you're driving better operational outcomes, if that's a term, because now you've got the adequate data that you need in the documentation that is coded appropriately. And so the hope is that you don't get a clawback or a recoupment, but if that happens, now you've got some data that we know hasn't gone missed in documentation for claims.
Mm-hmm. Yeah. All right, so how do we integrate AI successfully? We think of it as potentially a three-prong approach. So first, you want to define your objectives. What KPIs are you trying to accomplish? Identifying what are your current RCM issues or struggles that you guys are having. And then also to list out those realistic goals of what you would like to see happen. From there, you're able to, do data collection and preparation. So utilizing AI, and initially you can go in and run a use case analysis or really see where you're at from the beginning. Where are your levels hitting? Are you, hitting more 3s than 4s? Is there an opportunity to increase your level 3s to level 4s? Which is a big jump in reimbursement there. Also assessing your current infrastructure. What tools do you currently have? So are you utilizing the same EHR as your practice management system? Does your practice management system have the capability to include AI as an offset to help assist what your current processes are today? So being able to go through and select, which AI model do we want to do, the full gamut? Do we want to start, with registration, insurance verification of benefits, all the way through coding, the claim processing, payments, working denials? Do you want that full model, or do you want to just maybe start with the coding aspect, the coding and charge entry piece, and assess where your claims process, how they process, are they denying, are they rejecting, is there improvement there before you maybe take that full leap of integrating the full picture? And then in AI integration, there is some training that is involved. So being able to do training with your providers. I call it lights on sessions that I have with my providers, so that they are fully trained on how it works, how they're supposed to see and respond to queries, and what that entails. And from there, we do a test run. So want to make sure that if there are any bugs or anything that is occurring with the technology, that we're able to run all the analytics beforehand. And then, of course, you set your go live date. And this process, it can, depending on the system that you use, how quickly you're able to identify all these key areas. It can take, 30, 60, 90 days to be able to implement the full AI to integrate.
Let me add something, Nikki. On the use case analysis,
Mhm.
the benefit there is just looking at your existing data, right, and giving you kind of a little more granular view of where there are gaps that we've noticed, or that AI could potentially fill those gaps, and then where efficiencies could potentially be made. And so we're trying to help augment anything with AI that we can to benefit the business. So out of that, there are understanding, like a dentist would say, you need a hygiene check, right? So let us go and look at the state of the union of your business today, all the way through payment posting, and can give you guys, some, I guess, adequate ammo to really drill down to your KPIs. Really is what the benefit would be, is just looking at your existing data and saying, hey, here's where we have gaps that we could get fixed, and here's the potential ROI, or here's the potential time savings, or here's the potential, whatever those goals are, could help you define that.
All right, so I'm going to show you an example of an integration process that XDion actually uses. So we start by getting specific EMR reports and chart details, which those automatically are extracted and put into our portal and through a batch run process. So once that happens, once all the information is extracted from the charts, then it feeds into our system, which then will analyze and extract that info data, which is then updated into we call it xdion.code. And then it moves on to the next, which is the automated coding process, where we're able to filter through, identify the correct ICDs, your CPTs, if there's HCPCS, even modifiers even down to the specific pairs. So, Medicare may utilize XU or whichever modifiers versus a commercial payer. So the system actually is organized and has everything set up in the background to be able to sequence all those to meet those coding guidelines. And so there are some EMRs out there where it does prompt the providers as they're documenting to enter in a certain E&M level or their diagnosis codes or any procedures that may have been done. And so our system will actually take those provider codes, and then it puts it up against the generated codes through the automated coding engine. That's what that ACE is there. And then from there, we are able to identify the revenue enhancement, which is any potential revenue leakage opportunities due to misdocumentation. So if there is misdocumentation and we need some clarification from the provider, then that will go into the provider engagement section, which goes into a portal communication system where it queries the providers and it asks them, is the is there additional documentation that you can add for this procedure? You missed a result for a COVID test. Can you please update that into the chart so that we then can capture it in the coding to be able to bill out? So obviously the goal at the very end here is we're going to then feed all of this information, all of these codes back into that practice management system to where you can submit a clean claim. Our goal at the end of the day is to do it right the first time. One and done, I say. So having those clean encounters, being able to optimize your revenue by capturing it the first time so that you have one submission versus having to revisit and do resubmissions, which cost you operational money. So there, you know, with AI, there are certain applications, so it's APIs, application programming interfaces, that do have to work together in order for the AI to communicate with that system. There are different systems that you can access various information. They compare it to, say, like a telephone. So it essentially, the AI will communicate through that API to gather all that information and pull it into the coding technology to be able to analyze and assign those codes appropriately. So there is some back-end processes that do need to occur to get the AI set up in order for it to communicate correctly with the different data sets. And so the API integration advantages, the neat thing is that we have a set of rules and protocols that enables that software to communicate with another. And so that the API with the AI tools that we have will help you with that backend automation. So that direct communication, enhanced data exchange. So it synchronizes that data and exchanges it with multiple systems if necessary. It also reduces the complexity. So reducing that need for manual processes or, you know, custom codes, and that's technology jargon there. And then also scalability. So you have a more robust system that can actually handle large amounts of data, whereas a human intervention may not be able to scale to that level. But if you don't have an API that's accessible, which we do find that there are a lot of EHRs that will not allow an outside AI system to connect with through their API. We've actually come up with another alternative, which is RPAs. That's your robotic process automation. And these are bots. They actually mimic human actions in a computer by extracting from digital forms. So there are other options if you don't have an API available. There's RPA. There's also, you know, a database download that can be done. I know that there is another, what is it, Mark? Snowflake, I think is the name. That we've been able to
They're like an
utilize.
intermediary. Yeah.
Yes. So we want to make sure that all the patient data is protected. It's HIPAA compliant, that there's no PHI that is being leaked. There are no breaches that can happen. So through these APIs, RPAs, the Snowflake, for example, it's able to protect that information. So an RPA, which is, as I stated, it's our bot. It does have some advantages. So it works just like a human, where it clicks buttons, it enters data, it reads documents just like a human would, it's crazy to think that that's actual technology that's out there today. So it does, front end automations by, the interactions that a human would have. So, for instance, checking and verifying benefits. Instead of as I mentioned earlier, instead of your registration staff picking up the phone, being on hold, having to go through even an automated system through the insurance company to verify benefits, if you're not able to get it immediate through your practice management system, the bot actually works to eliminate that task from your registration. It's any other scenario that you have in your RCM process, reaching out to insurance payers to understand what a denial is, or what's being denied, what's being rejected, why is this happening? It can actually mimic that human-like touch to free up your staff to be able to do some other more complex cases. They can focus on the higher level, strategic initiatives versus having to do those day-to-day tasks. It's also the ease piece of it. It's easier and it's faster to implement. Then, whenever you have to hire an FTE, it could take 2 to 4 weeks to get them trained up in your system, your processes. Whereas this, through RPA's AI integration, you're able to literally at a click of a button, it happens so fast, which in turn, it gives you some cost savings. So reducing your labor costs. You can utilize your current FTE model, but the great thing is that you're not going to have to add to that piece. So you're saving there and utilizing your staff for more important issues or tasks. All right, so you have your RPA versus your API automation. So deciding what your system is capable of doing. So, that API is your application programming interface. That RPA, your robotic process automation, which is those bots. What method of operation are you able to utilize through your current EHR and practice management systems that you have? Being able to utilize those to perform those use case analysis, as Mark was describing earlier, to see, where you stand today, and what your ROI could look like by utilizing AI. The reducing that complexity and the implementation of, a human FTE model. This is done, much faster. So much is done in the background that we don't see that happens, with speed and that efficiency, that can then handle much more errors or denials and rejections, which is ideal because that's where we tend to have a lot of our operation costs falling into that bucket.
Yeah, I had one point there. So RPA, API, I think Nikki mentioned this a second ago in terms of some EHRs allow APIs, some don't. Being EMR agnostic or EHR agnostic, we want to find the path of least resistance, right? So as we're looking at the data, it's going to be a measure of, does RPA make sense or does API make sense? So that's just, kind of behind the scene, wouldn't apply to any operator. They don't care. They just want it to work kind of mentality. And if I'm an operator, or when I was an operator, I wanted the exact same thing. So out of that, it's just there are some data elements that need to be captured for the AI. And how do we get that data element? And there's a laundry list of them that you need out of the chart or the potential before you send the claim. So API, RPA, that's just part of the data to how to get that information.
Awesome. Well, Mark, I think we're about to go into our Q&A piece of the presentation. Were there any other points that you wanted to throw in here before we got to that?
No, not for me. I mean, I know there's a couple of questions that have come in that
Okay,
we
great.
can go, and if you guys see the Q&A box down there in the middle of the screen, then you can just type those in, and then we'll get to them based on the time we have. Let's see, let me read the first one here. What happens to my RCM team, Nikki, if we implement AI?
Yeah, great question. So I think, we hear this question a lot. I know it's a fear with making the decision to leap to AI. As I was walking through the presentation, I did mention, there you can utilize your current RCM team for more enhanced cases, doing audits, high-level audits, using them for strategic initiatives. And the benefit of that is that the AI system is going to be able to handle all of those mundane, repetitive tasks, where, a lot of coders, when you're talking about coders and RCM staff, they may miss some of those things that that the AI is going to be able to see and recognize every single time. So being able to utilize them in a better fashion is very beneficial.
Thank you. Question 2 was just sent in, and the question was, can your system work with Experity Management System and EMR?
Yes. So our system does. I'm not sure about some of the other AI systems that are out there, but we have had the pleasure of working with multiple clients that utilize Experity, EMR and practice management side. So we are very well equipped. We have all the rules, processes, protocols in place already for Experity. So we can definitely discuss with you how that would look on an individual basis.
Yeah, I mean, the benefit is because we have experience, with the numbers. So we're EMR agnostic, right? So if there isn't much knowledge on it, we can have it swiftly. So, all right, there's one more. Do smaller urgent care centers have the resources to implement AI successfully, or is this primarily for larger systems?
That's a great question. So our company, and I believe most other AI systems, you can handle one clinic all the way to 500 and plus. So, it's deciding what is the smartest cost for you, but there's no prejudice against how many clinics you need to have or how much your volume is. If you want to implement this, and the goal is for you to, even if you're small scale right now, if you implement AI, it's going to improve your ROI. That's going to allow you the opportunity to be able to grow, gaining more clinics, increasing that volume. So it will work in tandem with what your goals are.
Yeah, I think, just to kind of add to that is, small or large, it's doing the work roughly of, I was at 10 plus FTEs. So if you look at a scalability, let's say you have one or a few locations today and you're wanting to scale to more locations, then this could help that process to where the coders that you have, very valuable, can work on other productive areas. And as you scale, now you're creating some operational leverage as well. And then from a larger system piece, there tends to be I guess, a bigger dynamic of some of the same subset of problems that a smaller group or urgent care might have, just on a bigger scale that AI can help tackle. Another question came in: who are the competitors and what are the AI products? Do you have a cost structure that can be shared? Well, we can answer this independently. And so just to make sure that we get you covered, let me take that one offline, and then we can just redistribute to all of the. Got a couple of different, and I'm not being cagey. I want to go through, because cost structure to me means 20 different things, right? I just want to make sure that I've got the cost structure that you're referring to and how you're thinking about it, because I don't want to be thinking about it differently and we're way off. So there are some nuances between states. Will your system be able to account for these differences in coding and billing?
Absolutely. Another great question. So we have, with our system, we have clients that are all across the US. And so you have certain payer specifics, you have, different jurisdictions through CMS that have different rules and guidelines. So yes, our system is able to implement all of that information. We create these rules in our technology that then feeds back. It codes everything correctly according to those payer guidelines based on state, and then we'll submit it to that payer with those correct guidelines so that they can be processed quicker.
Okay. And it's about 11:47. I think we have time for a couple of more. Let's see. What safeguards are in place to prevent the AI from overcoding or undercoding?
So we follow CMS and AMA guidelines. So we utilize that MDM table that AMA publishes as our basis of how we are capturing those E&M levels based on documentation. So everything is strictly based on how the provider documented. If we're seeing that maybe the provider coded a level 4, but the documentation actually only meets a level 3, that's an opportunity where we can go back to that provider and ask if there were, any additional documentation points, anything else that they're able to enter into the chart to help fulfill that level 4. There are some clients and providers that utilize the time-based coding. So if they're able to document that correct time and what they did in that time, then we can also capture that as the appropriate level as well.
Excellent. And let's see, how long does it typically take to integrate AI into an existing EMR or billing system?
Well, and Mark, you may want to piggyback off of this. What we have experienced, we'll say with Xperity, it takes no time. We already have everything implemented, all the technology set up, that it's really a quick and seamless process. That could take, once we get your clinic list, your provider list, your SOP, access to your system, access to the reports, then it's a matter of just connecting the dots in the background. So depending on when we can get the information from the client to actual go live, could be 30 days. It could take up to 90 days. We prefer it to be, the earlier time frame, just so we can get moving. But as Mark mentioned earlier, we are EMR agnostic. So we also utilize, ECW is another big urgent care platform that's utilized. We already have protocols set up for that as well as Epic, and some other EMRs that are pretty big out there. So time frame, it would not be impactful.
Yeah, I would just say that, it can be as swift as we get the information. So as long as we've got that dialogue back and forth to be able to get the data that we need, I would argue it even takes less time to roll out versus just configuring on the front end to make sure we have all the SOPs, all the providers loaded in correctly, and that can be done in the back end while we're doing something else. So, we want a quick rollout as quick as possible so you guys can start benefiting from the savings here.
Mm-hmm.
All right, let me see. There's another couple of questions here. How does AI help ensure ongoing compliance with constantly changing coding regulations and payer requirements?
Mm-hmm.
I think you touched on that, Nikki. Just maybe kind of reiterate what that.
Yeah. So our system knows when our AI knows whenever the CPT updates happen, the ICD updates happen. We do have systems in place. So if there are, just in April, Medicare did some updates. We're able to identify those when they happen, and all that process happens in the back end through our technology, where it updates rules, protocols. I keep using those two words, but it's really, everything is engineered to stay on top of all of the new codes that are rolled out, ones that are, no longer valid, ones that have more specificity, and then also, the payer rules. So if we even identify through some denials and rejections that you're receiving, that, okay, this payer is continuously denying this now, then we're able to go in and make those adjustments in our setup so that those denials don't keep occurring.
Awesome. Well, that about wraps it up. There may be a couple of lingering that I can just email. We're kind of going on to crunch time here, but I will. Any other closing comments, Nikki?
No, it was really great to be able to talk with you guys today. We welcome any questions or clarifications that you may have. Please reach out to Mark or myself, and we'd love to discuss with you.
And then with that, thank you, Nikki. Really appreciate everybody's time and participation. And I'll turn it back over to Samantha.
Thank you so much. I'm happy to close us out. To XDion and Mark and Nikki during today's presentation, thank you so much for partnering with us on such an important topic in urgent care medicine. It's really been a pleasure learning from you today. And to all of our attendees, thank you so much for your time and attention during today's webinar. We hope that you found this session insightful and valuable. And of course, as a friendly reminder, if you do have any questions or if something comes to mind later, don't hesitate to reach out to us at admin@neruca.org. We're always happy to continue the conversation. And a friendly reminder, the recording from today's webinar will be available on our YouTube channel in the coming days. And we really appreciate your participation and look forward to seeing you at our next session. Have an
Thank you.
awesome day.
Appreciate it.
Thanks, guys.
See ya.